Welcome to another Health Talk from Marz. It's out of this world. In today's episode, I want to talk about obesity and how it is a tremendous epidemic. And if you want to learn about it, stay tuned. Obesity is a major problem in the United States and industrialized countries for sure. And what we know is that obesity is really quite an epidemic. So, how we define obesity is that when the basal metabolic index goes above 30%, that's officially considered to be obese. When the BMI goes above 40%, then we call that morbid obesity or severe obesity. Currently in the United States, we have about 42.4% of the population is considered to be obese as of 2018. So, of that obesity, another 10% of those people are morbidly obese. So, morbid obesity and obesity account for a very large number of pathologies today. They're predisposing factors for sure. So there's a calculation. If we look at slide 1, you can see there's a calculation on how to do the actual calculation for BMI. It's based on your height and your weight, and the formula is there. A 6-foot person that is 72 inches, you square that and you get that number, and you take their weight and you times 703 and you get that calculation. Then you divide one into the other and you'll get your percentile. So you can do those calculations there. I'd like to turn to slide 3. So slide 3, we talk about what are conditions that basically obesity is a precursor of, or what makes you much more susceptible. So we know obesity greatly increases the risk of heart disease, and certainly diabetes and hypertension. Gallbladder disease is well known, intestinal disorders. So major differences happen in the microbiome. So that's one of the new research has shown that people that are obese, they have a much different microbiome. So reestablishing a proper microbiome is critical in the treatment of obesity when we talk about it. Respiratory diseases, infections of all type. So we know in COVID, obesity was a major factor in susceptibility to getting COVID, and also for the severity of the symptoms, and also for spreading COVID. So that's what we found during that period of time. Other, symptoms that are associated with obesity are joint pains, low back pain. I mean, you're carrying around all that excess body weight. That's something that's going to be problematic for sure. Alzheimer's disease and dementia. We know that excessive visceral body fat can lead to inflammation in the body. Usually, people that have obesity are usually going to be at least pre-diabetic or, diabetic outright. And these people have increased levels of insulin. Increased levels of insulin result in inflammation in your body. So measuring fasting insulin is an important biomarker to see what's going on. And lastly, we see that people are more susceptible to developing cancers of many different kinds. Certainly colon cancers, a big one, but also skin cancers and many other types of cancers as well can be related to excessive body weight. So some really interesting etiological factors, genetic factors involve parents. So if neither parent is obese, the average percentage of children that will go on to develop obesity is about 10%. So if one parent is obese, the chance of the offspring becoming obese goes up to 40%. If both parents are obese, the chances of developing diabetes goes up to 80%. So those are some startling statistics, which I think just point to the fact that the environment has a lot to do with why people develop obesity. When identical twins are raised apart from each other, there's a very significant weight difference. And that's has to do with basically the environment. Environment is probably a much bigger factor than the genetics actually is. So the environment plays a role. So when we talk about things that can create abnormal microbiome or can create elevated levels of insulin, these are all things that are related to what's going on in someone's environment. So what do we know from like studying fat cells? So we know that fat cell number increases rapidly from birth to puberty. Fat cells decrease in size with weight loss, but not in number. So that's an important statistic to note. So basically, what this is saying is that when you make fat cells early on, especially from birth to the first couple years of life, this is a critical period of time not to overeat. And why breastfeeding is so important. We know that breastfeeding infants results in less obesity later on in life. So the longer you can wait to do solid feedings, and make sure that when you do solid feedings that you do healthful foods and not create overweight babies, that's important. So treatment of obesity, well, starts with, the beginning, that is the parents. So in order to successfully treat obese children, you have to treat successfully the parents. So that's especially true growing up. One of the things that I recommend for people is to do what's called a hypoallergenic diet. A hypoallergenic diet is a diet that removes most food allergens. There was an important, what I feel is a landmark book, and it was written by Dr. Marshall Mandel, an allergist years ago, and it was titled, "It's Not Your Fault, You're Fat." And in there, he describes a very fascinating association of food allergies and food allergies that can affect your basal metabolism. So making sure that you consume foods that are hypoallergenic, I think is really important. Make sure you do emotional therapy. Emotional therapy is something that is critical. Obviously, there's a reason why people are overeating. It's possible to get obese overeating healthy foods. So, but most people that are obese are not eating healthy foods. They're eating a diet that's high in simple carbohydrates and high in dietary fats. And so those are foods that we want to try to avoid as much as possible. So, we go back, the ideal diet, we look to the blue zones. Blue zones are areas in the world where people live the longest and the healthiest. And so let's do what they do. So their diet consists mostly of carbohydrates. Anywhere from 60 to 75% of their calories comes from carbohydrates. And these carbohydrates are not as processed as most carbohydrates that we eat here in the United States. So about 15 to 20% of calories should come from fats and 10% from protein. Making sure you do some thyroid regulation is really critical. And then also some type of aerobic physical activity. It doesn't actually have to be very strenuous. It just has to be some activity. Get some motion on a daily basis. And that would especially hold true for making sure that after you eat, to prevent your blood sugar from going up too high, is to do a little bit of activity. So that is something that is important to pay attention to. So making sure also that you eat slowly. So eating slowly is really is also a simple but critical thing to be doing. So you want to make sure that when you eat, one, you use small portions. So you can always go back for seconds. So make your dishes smaller. So I remember when parents got older, they ate like birds, and my mom had all these tiny little dishes and stuff. And I was like, that's crazy. But actually, they've actually shown that if you use smaller dishware, you're going to actually eat less. So that would go also for drinking liquids as well. I remember I had a aunt and uncle that were alcoholics, and they had the largest wine glasses that you ever saw. I mean, they were like 3 glasses of wine in one. That's an example of, you want to downsize your eating things. Eat slowly, making sure that you put your utensils down between bites, even. So in Chew Your Food, there was an expression, an old naturopathic physician said that chew your food, at least 50 times. Well, do the best you can, but eat slowly, making sure that you don't gobble your food down. Gobbling your food results in a lack of the body's ability to satiate itself. In other words, it takes time for satiation mechanisms to kick in. And if you eat too rapidly, you're going to bypass those mechanisms and you're going to be able to just eat more and more. And then eventually you're going to get really full. So, eat slowly, use smaller dishes, downsize. If you need to get more food, you can. One of the tricks I do for people eating out is I tell people when they get their meal, they should take with them a container, a small container to take, for extra food that they're going to take home. And so what you want to do is actually put some of the food of your meal into your doggy box or your doggy container to take home with you. You can always go back and eat more of that, but if you have a smaller portion, you're going to tend to eat a smaller portion. So eat less food by immediately taking that food and putting it into a container, or at least, part of it, a third of it or so. And then you can always eat it, but, save it for later. In the treatment of obesity, as I mentioned previously in that book, It's Not Your Fault You're Fat, talks about treating food allergies and the fact that food allergies can cause people to gain weight for a number of reasons. They can interfere with endocrine function in the body. They can also cause a reaction to the thyroid system, which would reduce the level of activated thyroid hormone. So there's any number of mechanisms that could be related to food allergies and gaining weight. So probably the most important food allergens, I would say, for obesity are dairy and also gluten. So those are the 2 big ones. If we eliminate gluten and we eliminate dairy products, that is an excellent start to addressing weight loss issues. What we know about dairy products is that dairy products contain various types of proteins in them, one of which is casein. So in the brain, there are what's known as casomorphins, casomorphin receptors. So casomorphin receptors are basically receptors that bind onto casein, which is the protein found in dairy products. And once it binds onto them, it basically has an effect of like morphine. And so when you stop eating those foods, those casein food containing foods, what happens is those casomorphine receptors lose their ability to generate that same euphoric feeling that you get. So basically, there's a period of withdrawal symptoms when you eliminate dairy from someone's diet who's addicted to it. So, one of the things that I specialize in my practice is fasting and hypoallergenic diets. So, in obese patients, fasting can be a wonderful tool that we can use to break people of their food addictions. So there's a couple of fasting clinics. One, the largest and oldest fasting clinic in the world, Buchinger, is in Germany. I attended there a couple of years ago. Did a fasting program for a week, and I found that to be really a wonderful place because of the camaraderie there. So people need to have some camaraderie when they fast. Otherwise, they just don't do as well. So being around people that are also fasting and being around people that are advocating fasting can be a really beneficial thing. So with fasting, in people that have never fasted before, there is something called a prolonged kit. A prolonged kit is a fasting mimicking diet. So this was constructed by Dr. Walter Longo, who basically designed this little food eating kit for a 5-day fast. And basically you get to eat various types of foods, but only what's in the little boxes that it contains. And it has a certain set amount of carbohydrate, fat, and protein. And when you go on this particular eating regime, it's just like fasting, except you get to eat a little bit. It's not a lot, but you do get to eat. And that's why they call it the fasting mimicking diet. Okay, so if you do a short fast, and a short fast I consider is 5 days. So that is enough time to break various types of allergic eating cycles that people have. So, and as I mentioned, dairy products and gluten are highly addictive substances. So if you get rid of those two foods, you're going to do much, much better. So one of the things that is critical about fasting is when you come off a fast, you want to make sure you don't go on a seafood diet. That is, you see it and you eat it. So one of the things I recommend is an SOS diet. No salt, no oil, and no sugar, at least for a period of time. And that is a great transition. There is a fasting clinic down in Santa Rosa, California, and there they do water fasting, and they transition you onto an SOS diet. And again, that breaks a number of various types of allergic eating cycles that people get into. So what this does is it decreases the inflammation in the body, gets rid of fluid. So people find when they do a hypoallergenic or they do a fast that they urinate a lot. And so this is something that's great because that represents allergic fluid retention. So this is especially true in women in their menstrual cycles. Some women have a tremendous weight gain. I've had one woman patient years ago who gained 15 pounds of water weight during their menstrual cycle. And when it came time for their period, they basically excreted a lot of that weight out of the body. But that's a tremendous amount of weight that's due to inflammation or allergies. Another thing that can be very useful for breaking down the allergic tendencies of food is to do a ketogenic diet. So a ketogenic diet involves not eating much at all in the way of carbohydrate foods. Obviously, if you're doing a ketogenic diet, you're eliminating wheat from your diet. Also, ketogenic diet, various dairy products, because dairy products do have sugar, especially milk, you're eliminating milk as well. So it serves that same purpose as a hypoallergenic diet. We don't want to be on a ketogenic diet for an extended period of time. An extended period of time would be more than 6 months or so. But for a shorter period of time, that can have a tremendous effect on their ability to get rid of allergic fluid retention. I mentioned about the balance of carbohydrates, fats, and proteins, and we should mimic the same type of diets that we see in the blue zones of the world. Also, a Mediterranean diet. A Mediterranean diet is also well established to be beneficial for weight loss. Mediterranean diet probably for most people is going to be the easiest to achieve. So involves use of lots of grains and vegetables and such. So one of the things that we want to pay attention to with regards to the balance of calories is how much omega-3 fatty acids that someone is taking in. So most people are grossly deficient in omega-3 fatty acids. There's a test you can do. It's called an omega quant that measures omega-3 fatty acid percentage in red blood cells. So ideally, we want to get to anywhere from 8 to 12% of our percentage of omega-3 fats in our red blood cell membranes. Most people in the United States have an average of about 4 to 5%. So we know that omega-3 fatty acids will increase metabolic activity. So they've been shown to regulate various types of hormones called prostaglandin hormones that can regulate your metabolism. I mentioned thyroid regulation is really critical. Having enough thyroid in your tissues to get your basal metabolism is going to be great. There's some supplements that you can do to aid in the production of thyroid hormone. They include tyrosine, an amino acid that's critical for thyroid hormone production, zinc, copper, iodine, and selenium. So these nutrients can help enhance the activity of thyroid and increase your basal metabolism. Aerobic exercise, aerobic activity, daily activity, at least 20 to 30 minutes. So ideally to do this after one is eating is actually going to be critical at increasing the metabolic activity. So you want to maintain a heart rate of about 50 to 60% maximal. So that's a relatively low heart rate. So studies have shown that increasing your heart rate too much, which can be good for your heart and such, but not necessarily is good for weight loss. So things like cycling can be really helpful. Cycling tends not to raise your heart rate up very much, depending upon what kind of cycling you're doing, and can burn an extreme number of calories. Doing some long-term activity like hiking or cycling can be really useful. One of the things that we know about burning calories is that brown fat, which does exist when we're young, is more metabolically active. And now we've actually seen that it's possible to generate more brown body fat by eating good foods. So one of the things that we know is that cold exposure. So doing hot and cold or hydrotherapy can be useful for stimulating brown fat exposure. So doing cold plunges, surfing in the wintertime certainly can lead to an increased amount of thermogenic brown body fat. Some certain supplements can also be useful. Green tea, which does have caffeine in there, can be stimulatory of brown body fat. Also, the natural sugars found in fruits can also actually be really helpful. So we like to select fruits that maybe have a lower glycemic index, like berries, blueberries, blackberries, raspberries, maki berries. These berries can be really good and again, stimulating brown body fat, but also tending not to raise your blood sugar up very much after you eat them. So maybe avoiding fruits such as oranges or pineapple that have a lot of sugar in them, and stick to the lower glycemic types of foods. Okay. So one of the things that we have found that's really, really quite important is to make sure that you are consuming enough fiber. So we know that satiety mechanisms in the body can get way off. In other words, they might not work very well. So one of the things that we want to do is to enhance our microbiome in our GI tracts. And so we know there's an excellent book, Will Bulsiewicz, Fiber Fueled, that I recommend for most all people that have a weight problem situation. Is I like to recommend at least 30 different types of whole plant foods per week and try to consume in the neighborhood of at least 40 to 50 grams of fiber a day. So that's a lot of fiber. It can be done. Usually it's going to require a certain amount of eating beans. So eating beans are one of the best foods that you can do. So beans, black beans, pinto beans, lima beans, kidney beans, lentils, tofu, soybean products. Those are all legumes that can have a tremendously beneficial effect and not raising your blood sugar up and not increasing your levels of insulin. Increased levels of insulin will store more body fat. So your goal is to try to decrease your insulin as much as possible. What we know is that hemoglobin A1C, any hemoglobin A1C above 5.3 is most likely too high. So that means that your average blood sugar is up over 106. So we want to get your hemoglobin A1C at least at 5.3 and below. So what does fiber do? It enhances your microbiome. So one of the things that we know is that if you upset your microbiome, can actually stimulate you to gain weight by decreasing your basal metabolic rate. So fiber increases satiety in the body, which is really, really important. Fiber reduces the bowel transit time and detoxifies the body. And one of the things that I sometimes will recommend for people is to do, there's a fiber called konjac, or in Japan it's called konjaku. And this is the most viscous soluble fiber ever found in nature. And I will give this to people before they eat a meal, about 15 minutes before they eat. By doing that, one, it increases the level of satiety of that meal and also down-regulates the spike in blood sugar from whatever carbohydrate you might be eating. So it's a prophylaxis for reducing blood sugar. And as I mentioned, going for a short little walk is also really beneficial after you eat a meal, because that is going to burn sugar and prevent your insulin from spiking up too high. Psyllium seed fiber is also another one in the form of Metamucil. I like just plain psyllium seed powder. Metamucil a lot of times has artificial color and flavor in there, so better to avoid those things. I mentioned that natural sugars found in fruits actually stimulate the production of brown body fat in the body. So we know that fructose in the form of high fructose corn syrup is something that's not so good for your body long term, and it will increase your hemoglobin A1C. So there are various substances or compounds that we can use to facilitate weight loss. I use a number of them depending upon the individual. One of them is an herb called yohimbine. Yohimbine is an herb that actually blocks these receptors in your body. Uh, they're called alpha receptors. So in the body, there's alpha and beta receptors. If you block the alpha receptors, you will preferentially stimulate the beta receptors. So you probably have heard of beta blockers. Beta blockers are drugs used to treat various heart conditions that basically slows down the heart and decreases blood pressure. Well, this does just the opposite if you block the alpha receptors. So yohimbine is a pretty potent herb, and what happens is it can stimulate the burning of fat in areas in the body that you want it to get removed from, like in the abdomen, for example, or your love handles. So because yohimbine binds onto those alpha receptors that are more prevalent in those areas where we store excessive levels of fats. Green tea. Green tea is a wonderful herb. Green tea is something that has shown to have a number of great antioxidant capabilities in the body to protect tissues from oxidative damage. It can prevent or decrease the amount of dementia or Alzheimer's disease, but it also will stimulate a basal metabolic activity in the body. So drinking green tea on a daily basis, I think, is something that could be really beneficial. Of course, make sure you monitor blood pressure and pulse rate, make sure it doesn't get overactivated there. Some other herbs that can be really beneficial are ephedra. Ephedra is something that was banned by the FDA a number of years ago, but you can still get ephedra tincture that is available through herbalists or naturopathic physicians mostly. Kola nut is also something that can be used to stimulate metabolic activity. Glycyrrhiza, so glycyrrhiza that has licorice in there. So you might have heard of deglycyrrhizated licorice root. So deglycyrrhizated licorice root has had the glycyrrhizic acid removed, and as a result, it doesn't have that same stimulatory activity. So you want to use just straight licorice for increasing metabolic activity. So protein supplements can be supportive in weight loss. High quality protein helps in muscle maintenance. Carnitine is an amino acid that can be useful at maintaining body weight. Also, creatine. Creatine has been shown to increase in also muscle mass, and as well as arginine. So those amino acids can be helpful at decreasing fat and increasing lean body mass. Protein supplements can have an effect at decreasing cravings for different types of foods. And it should be, tailored to each individual as far as the amount that's used. In summary, we want to make sure that we basically try to reorganize how people eat. And that means if someone is obese and they're eating a certain way, everything that they do needs to get changed. So eating with people is also really, really important. So there's a social component. I talked about blue zones. In blue zones, everyone eats together. When you eat together, you eat more slowly because you're talking more to other people. And also, I think that it adds to your ability to regulate your food intake. So eating socially, I think, is really, really important. And making sure that we get an abundance of fiber. Abundance of fiber is critical. So what you need to know is there's a formula basically for weight loss. And what we know is that 1 pound of body fat is equivalent to 3,500 calories. So if we use as an example, let's say your basal metabolism is 1,200 kilocalories. So calories are usually expressed as kilocalories more technically. And you are burning, and let's say an additional, so 300 calories. So basal metabolism is you're lying in bed, not doing anything, and they measure how many calories you give off. And then if you have a little bit of activity just every day, you might have, sitting, going to the bathroom, preparing your meals, etc. You're going to burn a certain number of calories. So let's say that comes out to about 300 calories. So now you have 1,500 calories that you're basically expending. So depending upon your physical activity will determine how quickly you will lose body fat. But let's say at 1,500 calories is your basal level, then what you want to do is to try to get about 500 calories less than what you would normally consume. And 500 calories a day times 7 days gives you 3,500 calories. So you will lose 1 pound of body fat for every 7 days. And that's a pretty good weight loss rate. So we know that if you lose weight too rapidly, it tends not to work very well. So you can eat less, so 500 calories less in your meal, or you can just increase your physical activity. And we have a number of different tables that shows calorie expenditure. So you can read over those calorie expenditures. Obviously, walking at 2 miles an hour versus 3 and 4 miles an hour, you can burn twice as many calories walking twice as fast. So, and I mentioned not getting your heart rate up too high is actually more beneficial for weight loss. So, physical activity, reducing the amount of calorie consumption leads to, your body weight loss. And that's something that it's better. It's been shown that if you lose 1 to 2 pounds of body weight per week, it's going to be much more effective than if you lose a bunch of weight all at once. It tends not to be very sustainable. I think that's it for our talk on obesity. And there's a lot of books out there that are important. I like Dr. Joel Fuhrman. Ending Diabetes was a book he wrote that also can double as for weight loss. But Fat and Sick and Nearly Dead is a movie documentary I also will recommend as well for people to get inspired. And this was someone who was pretty obese and took it upon himself to lose weight, and it's I think it's very inspirational. Thanks for watching another episode of Health Talk from Marz. It's out of this world. If you like what you heard, click like and subscribe below. And you can go to my website, marznutrition.net, and check out our products over there. So thanks again for watching.